What is the most accurate site to monitor brain temperature during DHCA? A. Rectal temperature. B. Nasopharyngeal temperature. C. Tympanic membrane temperature. D. Bladder temperature. Answer: B. Nasopharyngeal temperature. Explanation: nasopharyngeal temperature correlates well with brain temperature and is widely used for cerebral temperature monitoring during DHCA. Other sites like rectal and bladder lag behind central temperature changes. Which of the following interventions improves spinal cord protection during prolonged DHCA? A. Hyperventilation. B. CSF drainage. C. Use of vasoconstrictors. D. Trendelenburg positioning. Answer: B. CSF drainage. Explanation: cerebrospinal fluid, CSF, drainage reduces spinal cord pressure, enhancing spinal perfusion during periods of circulatory arrest. It's especially used in thoracoabdominal aortic aneurysm repairs involving long durations of DHCA. What is the role of corticosteroids, e.g. methylprednisolone, administered before DHCA? A. Maintain euglycemia. B. Induce cardiac arrest. C. Provide anti-inflammatory and neuroprotective effects. D. Prevent arrhythmias. Answer: C. Provide anti-inflammatory and neuroprotective effects. Explanation: steroids are used as part of a neuroprotection protocol in some centers to blunt inflammatory responses and provide some degree of neuroprotection during DHCA, although data supporting their efficacy is mixed. Which of the following is an advantage of antegrade cerebral perfusion, ACP, over DHCA alone? A. Requires no arterial cannulation. B. Can be performed without cooling. C. Allows longer safe circulatory arrest time. D. Avoids use of cardiopulmonary bypass. Answer: C. Allows longer safe circulatory arrest time. Explanation: ACP maintains some cerebral blood flow during arrest, enabling safer prolonged procedures, up to 60 to 90 minutes, compared to the 20 to 30 minute limit of DHCA alone. It's often used during complex arch repairs. What is the effect of DHCA on systemic inflammatory response postoperatively? A. It eliminates inflammation. B. It reduces cytokine release. C. It may enhance the systemic inflammatory response. D. It leads to permanent immunosuppression. Answer: C. It may enhance the systemic inflammatory response. Explanation: hypothermia and bypass can both stimulate inflammatory cytokine release. Combined with rewarming and ischemia-reperfusion injury, this may lead to an exaggerated systemic inflammatory response syndrome, SIRS, postoperatively. Which of the following factors increases the risk of postoperative cognitive dysfunction following DHCA? A. High intraoperative hematocrit. B. Short cardiopulmonary bypass duration. C. Advanced patient age. D. Use of antegrade cerebral perfusion. Answer: C. Advanced patient age. Explanation: elderly patients are more prone to postoperative cognitive dysfunction due to reduced cerebral reserve and impaired autoregulation. Age is one of the most consistent risk factors identified in DHCA outcomes. Which of the following best describes how deep hypothermia affects the coagulation system? A. Enhances platelet aggregation. B. Stabilizes clotting factor activity. C. Impairs both platelet function and coagulation factor activity. D. Has no significant effect on coagulation. Answer: C. Impairs both platelet function and coagulation factor activity. Explanation: deep hypothermia impairs platelet adhesion and aggregation and reduces the enzymatic activity of clotting factors, leading to coagulopathy, one of the key complications after DHCA. Which technique allows for selective perfusion of the right hemisphere during DHCA? A. Femoral artery cannulation. B. Axillary artery cannulation. C. Inferior vena cava perfusion. D. Coronary sinus perfusion. Answer: B. Axillary artery cannulation. Explanation: axillary artery cannulation permits antegrade cerebral perfusion to the right hemisphere via the innominate artery. It's preferred for neuroprotection during aortic arch surgeries with DHCA. During cooling for DHCA, which of the following physiologic responses occurs first? A. Decrease in cerebral oxygen consumption. B. Increase in cardiac output. C. Decrease in blood viscosity. D. Increase in enzymatic activity. Answer: A. Decrease in cerebral oxygen consumption. Explanation: cooling leads to an immediate drop in cerebral metabolic rate and oxygen consumption. This is the protective mechanism that makes DHCA viable for procedures requiring full circulatory arrest. Which of the following methods is most appropriate to prevent gas embolism during rewarming after DHCA? A. Use of hyperbaric oxygen. B. Slow rewarming with controlled venous pressure. C. Avoidance of neuromuscular blockade. D. Increasing ventilation rate. Answer: B. Slow rewarming with controlled venous pressure. Explanation: rapid rewarming can cause gas microbubble formation, especially nitrogen, leading to cerebral gas embolism. Controlled, slow rewarming and proper de-airing techniques are critical to avoid this.